This ASH 2021 I call it a lymphoma ASH 2021 because we had so many interesting practice-changing abstract for B-cell non-Hodgkin's lymphoma. Right from the beginning in the frontline setting, we saw POLARIX study, which is a phase III randomized double-blind placebo-controlled study of R-CHP and R-CHP, which was technically positive study for patients with newly diagnosed high IPI diffuse large B-cell lymphoma. I'm very hopeful. I saw the data, and first time in so many years we have a positive study in a frontline setting in large cell lymphoma. So I'm very hopeful that it will be approved and it is a practice changing. The other was first time ever we saw 3 studies in the same setting of relapsed refractory diffuse large B-cell lymphoma, especially primary refractory setting, where patients were randomized between the chemoimmunotherapy, high-dose chemoimmunotherapy versus followed by transplant versus CAR T. So if you look at ZUMA-7, Transform, and BELINDA, all 3 actually focused on that population. ZUMA-7 and BELINDA has a bit matured data compared to Transform. And ZUMA-7 and Transform both were positive in favor of the CAR T in that setting, so second-line setting, compared to BELINDA, which did not show any difference. I do believe that BELINDA was negative because of the fact that the patient population as well as the CAR T cell preparation time was a little bit delayed. But overall, I feel that is also practice changing, and I'm very hopeful that exa-cel will be approved in a second-line setting. And the third group of abstract that I was very impressed with was Mosunetuzumab and Glofitamab. Both are the bispecific antibody, and they're either in a single agent in follicular lymphoma or in combination with either lenalidomide or polatuzumab. All were very impressive data. Very good progression-free survival and overall responses that we saw in this race. So that is also a, so to speak, new kid on block for B-cell lymphoma to be approved. And the last, we saw CAR T data. ELARA studies, long-term data were also presented at 17-month follow-up, which consistently showed progression-free survival and impressive overall responses and complete response rates of T-cell in follicular lymphoma. So a lot of data were presented in B-cell non-Hodgkin's lymphoma in this ASH meeting, and they were all practice-changing or very impressive novel agents on horizon for B-cell non-Hodgkin's lymphoma. So very exciting times.